Hi mamas, today we're going to peanut for pregnancy posture and for acid reflux. Find yourself a doorway. You can choose a flat wall if you prefer, but I like with a doorway that you can kind of extend your head beyond the door frame. It's a little bit more comfortable than mashing your face up against the wall. We're going to work along our rib cage above the lower rib line. We don't want to be working up underneath the diaphragm, but intentionally we will be affecting the diaphragm. And then we're going to trace along two sides, one lateral side and then the other lateral side of your sternum up to the just below your clavicle, and then we can trace along the upper pec to the shoulder girdle. And what this is going to help you do is it's going to help you to extend your back up a little bit and have a little bit more space in through your upper abdominal region, and to relieve some of that gastric pressure. So start on one side. You pick any side you want to, but make sure that you're doing everything equally on both sides. I like doing the peanut in the vertical position as opposed to the horizontal position. It's a little bit easier to access where we want to get into, okay? So we can start up underneath the breast line and just go really, really slowly, particularly on this spot because it is very, very sensitive. These are trigger points for your serratus anterior, so they protract your scapula forward, and the more forward our posture is, the more slumped our posture is, the more tender this area will be. And then you slowly work up underneath your breast tissue. Once you get to this midline, you're going to find it's a lot more tender. These are the money spots for the acid reflux. And really think about sinking in instead of frictioning or rolling. Think about sinking in and diaphragmatically breathing through here. So you're really going to allow your belly to extend out and come back in again. Really focusing on lengthening the exhalation. And then you can trace up a little bit further. Again, I'm just on the lateral border of the sternum, as you can see here, and it's medial to the breast tissue. Okay, and you can trace up a little further. Just do really one spot at a time. You can kind of inchworm yourself up. And again, this whole sternal line on the lateral piece, not the very center, will be very tender because of all the shortening that happens in our natural pregnancy posture. So think as much as you can about extending your shoulders back and extending your back and opening your chest while you're doing this. You can even, once you get up into the upper breast tissue, pec tissue, you can even extend your arm out and really get a good stretch in here. But again, work very slowly at your pace. And if you're putting minimal pressure because it's sensitive, that's okay. This isn't something that we really need to tackle in order to relieve the sensitivity and the reflux. We really need to go gently and respect our body's limitations. And again, you can trace all the way up underneath that clavicle to the shoulder. Once you get into the shoulder, you can again do some range of motion to open up that tissue. You can even rotate your torso to the opposite direction and engage your neck a little bit to open in through this anterior triangle of your neck. On the opposite side, obviously you'll cover both sides. We're going to start against our spine. And you can start in either direction. You can start out laterally on the rib cage and trace up, or you can start up on the rib cage and trace down. Again, slowly sinking in, breathing with your belly as much as you possibly can in a relaxed fashion. Longer exhalations than inhalations. And then you'll trace all the way out to the side of the rib cage. Sometimes it's easier just to rotate your rib cage into the door frame instead of holding the peanut and trying to place it appropriately. And really, if you really want to get creative and you got a bit more time to spend, you can really roll up all the way from that point into the axilla. But that's all we're going to cover for today. Drink water, be well.